Welcome back, everybody. We're going to go ahead and get started. I am Brian Masters. I am a client manager for Xpio Health, and I'm going to be your guide and instigator for today's session. Thank you for being here. We're getting started on the second edition of our EHR optimization webinar series. And okay, show of hands. Who here has started to love their EHR since our last webinar? Yeah, I know. It's a process. Rome wasn't built in a day, and a great relationship with your EHR takes time and effort to cultivate, but don't worry, we're going to get there. In our first webinar, I challenged you to start changing your perspective on your EHR system. We explored the potential for EHR optimization to transform your EHR from a burden into a powerful tool that enhances the quality and efficiency of the care you provide. Today, we're going to take the next step in that journey. We'll be diving into the practical strategies for assessing your EHR system's performance and user satisfaction. These assessments are crucial because they help you identify specific areas where your EHR is falling short, so you can target your EHR optimization efforts for maximum impact. And by the end of today's session, you're going to have a clear roadmap for evaluating your EHR system and pinpointing opportunities for improvement. You'll be one step closer to building that positive, productive relationship with your EHR that we talked about before. Remember, learning to love your EHR is a journey, not a destination. It requires a commitment to continuous assessment, optimization, and improvement, but I promise you, this is a journey worth taking. As you start to see the benefits of an optimized EHR, improved patient outcomes and increased efficiency and reduced burnout, you're going to find yourself falling in love with the possibilities, if not the EHR itself. So let's dive in and take the next step together. Get ready to assess, optimize, and maybe start to see your EHR in a new light. Now, in our previous session, we dug into the significance of EHR optimization, and we highlighted its potential to transform the delivery of mental health and substance use disorder treatment. And we discussed how optimized EHR systems can streamline clinical workflows, improve patient outcomes, and enhance the overall quality and care in behavioral health settings. Building on this foundation, today's webinar is going to focus on the practical aspects of assessing EHR system performance and user satisfaction. This natural progression from understanding the why to exploring the how of EHR optimization is going to equip you with tools and strategies needed to identify areas for improvement and drive meaningful change in your organization. First, a bit of housekeeping. There'll be a recording of today's session, and it'll be made available to attendees, so feel free to take notes, but if you'd rather just sit back and listen, you can always refer back to the recording. Also, there'll be a Q&A session at the end of this presentation. So if you have questions, please enter them in the Q&A chat feature. We're going to answer all queued questions at the end of this webinar. It's time for some introductions. I'd like you to meet Thad Dixon. Thad is the founder and CEO at Xpio Health. Thad brings more than 20 years of experience in behavioral health care, and he holds numerous certifications related to security, privacy, and technology. Thad is a recognized expert and frequent speaker on issues related to behavioral health technology and national health care. And we also have EHR whisperer Jill Johnson, our director of EHR services, with more than 25 years in behavioral health. Jill has a deep knowledge of billing, financial, and the technical aspects of operations. She oversees all of Xpio Health's EHR-related projects, and Jill is an expert in integrating these systems into healthcare organizations' broader operations. Now, throughout this six-part webinar series, we're going to provide comprehensive insights into EHR optimization. We'll cover its importance and strategies and best practices. Each session is going to build on the last and is going to offer you a thorough understanding of how optimizing your EHR can transform healthcare delivery and outcomes. Today's session is going to focus on the role of assessment in EHR optimization. You're going to walk away with actionable insights and strategies that you can apply immediately. Again, feel free to ask questions using the chat feature, and we'll address them during the Q&A session at the end. So sit back and get ready to learn. Here we go. Throughout this webinar, we're going to address key topics and questions that are essential for conducting effective EHR system assessments in behavioral health settings. You're going to learn how to effectively measure and analyze EHR system performance, focusing on metrics that are particularly relevant to behavioral health, like documentation quality and care coordination and patient engagement. We're going to learn what tools and strategies can be used to gauge user satisfaction among behavioral health providers and administrative staff and patients, taking into account the unique concerns and expectation of each group. And we'll also learn how those assessments drive targeted improvements in EHR optimization efforts, enabling you to prioritize changes that will have the greatest impact on the quality and efficiency of behavioral health care delivery. We invite you to reflect on your own experiences and challenges with EHR systems within your organization, and consider how issues related to performance and user satisfaction have impacted your ability to deliver high quality care. Okay, with a clear understanding of why EHR optimization is crucial in behavioral health, let's now explore how we can effectively assess our systems to pave the way for meaningful improvements. In this next section, we'll dive into the role of assessment in EHR optimization and how it sets the stage for enhancing the performance and usability of your EHR system. Get ready to take your first step toward transforming your organization's EHR experience. Okay, now we're going to discuss the role of assessment in EHR optimization. In the context of EHR optimization for behavioral health, an assessment serves as the foundational step. It provides crucial insights into your current system's performance and user satisfaction. You can identify areas that are working well and those that need improvement. This information is essential for guiding your optimization efforts in the right direction, ensuring that you focus on the most critical aspects of your EHR system that impact the delivery of behavioral health care services. Without a comprehensive assessment, optimization efforts might be misdirected or ineffective, or might lead to wasted resources and missed opportunities. When assessing your EHR system, it's important to consider two key areas: performance metrics and user satisfaction. Performance metrics refers to quantitative data that reflects the technical functionality and efficiency of your EHR system. In behavioral health, these metrics may include system uptime, or speed of accessing patient records, or time required for completing documentation, and error rates for data entry. These metrics are going to provide an objective view of how well your EHR system is functioning from a technical standpoint. On the other hand, user satisfaction is different. This is a qualitative measure that captures the experiences, ease of use, and overall contentment of end users interacting with the system. In behavioral health settings, user satisfaction encompasses the perspectives of mental health providers, administrative staff, and even patients who may be able to access their health information through portals. User satisfaction is every bit as crucial as technical performance, because even a technically sound EHR system may fail to deliver good results if users find it frustrating or difficult to use. Now, to gain comprehensive understanding of your EHR system's effectiveness, it's essential to adopt a holistic approach that considers both performance metrics and user satisfaction. By integrating these two assessment areas, you can identify the technical strengths and weaknesses of your system while also understanding how these factors impact day-to-day experiences of your users. Moreover, continuous feedback from users should be an integral part of your assessment process. Regular feedback allows you to stay tuned to the evolving needs and challenges of your behavioral health team, enabling you to refine your optimization efforts accordingly. It's crucial to recognize that EHR optimization is not a one-time event, but rather an ongoing process. As the landscape of behavioral health changes, with new best practices and technological advances and regulatory requirements that are emerging, your EHR system must adapt to keep pace. Regular assessments allow you to continuously monitor and improve your EHR system, ensuring that it remains a valuable tool for supporting high quality behavioral health care delivery. Okay, so we see how assessment plays a vital role in EHR optimization by providing insights into performance metrics and user satisfaction. By taking a holistic approach that integrates these two areas and incorporates continuous feedback, you can set the stage for ongoing improvements that keep your EHR system aligned with the unique needs of behavioral health. And with an understanding of assessment's pivotal role, let's delve into how we can systematically evaluate our EHR systems for optimal outcomes in behavioral health settings. For instance, think about it. What if your clinicians could document each session in less than 10 minutes and save them 2 hours every day? Would that affect the general satisfaction level of your team? Yeah, spoiler alert, it really, really would. So now let's talk about key performance indicators for EHR systems. Key performance indicators, or KPIs, these are quantifiable measures that help evaluate the effectiveness and efficiency of your EHR system in meeting your behavioral health organization's goals. These metrics provide clear, data-driven picture of your system's performance, allowing you to identify areas that need improvement and track the impact of your optimization efforts over time. In the context of behavioral health, KPIs serve as critical tools for ensuring that your EHR system is supporting the delivery of high-quality mental health and substance use disorder treatment. And by monitoring and analyzing relevant KPIs, you can make informed decisions about where to focus your optimization efforts for maximum impact on patient care and organizational efficiency. System uptime is a crucial KPI. This measures the reliability and availability of your EHR system to users. In behavioral health settings, where access to patient records and documentation tools is essential for providing timely care, high system uptime is simply non-negotiable. Industry benchmarks for system uptime typically range between 99.5 to 99.9%, which translates to no more than 4 hours of unplanned downtime per month. Regularly tracking and reporting on system uptime can help you identify potential issues and ensure that your EHR system is meeting the needs of your behavioral health team. On the other hand, measuring the time it takes for users to complete common tasks in your EHR system, such as loading patient notes or documenting progress notes or ordering medications, can provide valuable insights into system efficiency and user satisfaction. For example, if it takes a clinician several minutes to load a patient's treatment history or document a therapy session, this can lead to confusion, decreased productivity, and potentially it can impact the quality of care. By tracking these task completion times and setting targets for improvement, you can optimize your EHR system to better support your behavioral health workflow. Complete patient care data is essential for making informed treatment decisions and ensuring continuity of care. Tracking error rates in data entry and processing can help you identify potential issues with your EHR system or user training that may compromise data integrity. Strategies for reducing error rates may include implementing data validation rules, providing targeted user training, and optimizing EHR forms and templates to minimize the risk of human error. And by regularly monitoring error rates and taking proactive steps to address issues, you can ensure that your EHR system is supporting high quality, data-driven behavioral health care. Behavioral health organizations must adhere to a complex web of standards and regulations governing the security and privacy and management of patient data. Relevant regulations may include HIPAA for protecting patient privacy, 42 CFR Part 2 for governing the confidentiality of substance use disorder treatment records, and state-specific mental health laws. Regularly auditing your EHR system's compliance features, such as access controls, audit trails, data encryption. These can help you ensure that you are meeting your legal and ethical obligations. Now, while the KPIs we discussed above are common across behavioral health organizations, it's important to recognize that not every organization has the same goals and needs. Every organization's goals and needs are unique. So to get the most from your optimization efforts, consider aligning your KPIs with your organization's specific objectives, like improving patient engagement or reducing no-show rates or increasing the efficiency of care coordination. Conducting stakeholder reviews or surveys can help you gather insights into the specific needs and pain points of your behavioral health system. Use this information to develop custom KPIs that are relevant and measurable and achievable for your organization. And remember to regularly review and adjust your KPIs as your organization grows and goals and industry standards evolve over time. Okay, we have learned that KPIs are essential tools for monitoring and optimizing the performance of your behavioral healthcare system. Your EHR, by monitoring metrics related to system uptime, task efficiency, data accuracy, and regulatory compliance. You can identify areas for improvement that make data-driven decisions about your optimization efforts. Now that we understand how to measure our system's performance, let's explore how to gauge and incorporate user satisfaction in our optimization efforts. In this next section, we are going to discuss strategies for collecting and analyzing user feedback to ensure your system is meeting the needs of your behavioral health team. Let's take a look at how we collect and analyze user feedback. User feedback plays a crucial role in understanding the effectiveness of your behavioral health EHR system and identifying areas for improvement. While the performance metrics provide valuable insights into the technical aspects of your system, user feedback offers a qualitative perspective on how well the EHR meets the needs of your diverse user groups. In behavioral health settings, EHR users may include health providers or mental health providers like psychologists and psychiatrists and social workers, and it'll include administrative staff and IT professionals, and even patients if they access their health information through patient portals. Gather feedback from these diverse groups. It's essential for gaining a comprehensive understanding of your system's strengths and weaknesses. Okay, to ensure that your feedback collection efforts are inclusive and representative, start by identifying and segmenting your EHR user population. Consider factors like job roles, departments, and levels of EHR expertise when defining your user groups. This segmentation will help you tailor your feedback collection methods and questions to the specific needs of perspectives of each group. When gathering feedback, it's important to create an environment that encourages participation and honest responses, right? So ensure that users understand the purpose of the feedback collection and how their input is going to be used to drive improvements in the system. Emphasize the confidentiality of their responses and consider offering incentives for participations like maybe gift cards or recognition programs. Tools and methods for collecting feedback include surveys, interviews, focus groups, and direct observation. Let's look at each. Surveys are a common and efficient method for collecting surveys from a large number of users. When you design your survey, consider including a mix of question types, like open-ended questions for gathering qualitative insights and Likert scale questions for quantitative ratings of specific aspects of the EHR system. And to maximize response rates, Keep your surveys concise, keep them focused, and distribute them through channels that are easily accessible to your target user groups, such as email or in-app notifications. And be sure to send reminders and follow-ups to encourage participation and ensure that your feedback is representative of your user population. One-on-one or small group interviews are great. They provide an opportunity to gather in-depth feedback and explore specific user experience and issues. Interviews can be structured, following a predetermined set of questions, or semi-structured, allowing for more flexibility and follow-up questions based on the user responses. When conducting interviews with behavioral health professionals, be mindful of their busy schedules and their limited availability. And consider offering multiple time slots and multiple interview formats like in-person or phone or video to accommodate their preferences and to ensure maximum participation. Focus groups bring users together that have similar roles or experiences to facilitate the detailed discussions and generate the ideas for EHR improvements. When you're selecting participants for focus groups, aim for a diverse mix of perspectives while ensuring that the group dynamics will be conducive to open and productive conversations. And include your most vocal critics. Their perspective and buy-in are crucial to the impact of a project. As a moderator, your goal is to guide the discussion and encourage participation from all members, and keep the conversation focused on key topics of interest. Be prepared with a set of open-ended questions and follow-up prompts to stimulate meaningful dialogue and elicit actionable insights. Observing users as they interact with the EHR system in their natural work environment, this can provide valuable insights into usability issues and workflow interruptions that may not be captured through other feedback methods. So when you're conducting observations, be as unobtrusive as possible, and do what you can to avoid disrupting the user's normal workflow. Use a structured observation checklist or a note-taking template to ensure that you're capturing key information consistently across different observation sessions. Now, once you've collected feedback from your user groups, the next step is to analyze the data to identify common themes and pain points and areas for improvement. For qualitative feedback, such as open-ended survey responses or interview transcripts, use manual coding or qualitative analysis software to categorize and organize the data based on recurring topics or sentiments. When prioritizing areas for improvement based on user feedback, consider factors like the impact of patient care, or the frequency and severity of reported issues, and the feasibility of implementing proposed solutions. Involve key stakeholders like clinical leaders and IT staff in the prioritization process to ensure transparency and buy-in for the proposed changes. To turn user feedback into tangible EHR optimizations, develop clear action plans that outline the objectives and timelines and responsible parties for each improvement initiative. Regularly communicate progress updates to your user groups and demonstrate the impact of their feedback and foster a culture of continuous improvement and collaboration. Remember that EHR optimization is an ongoing process, and that user feedback should be collected and acted upon regularly to ensure that your system continues to meet the evolving needs of your behavioral health organization. Okay, here's what we learned. Collecting and analyzing user feedback is an indispensable part of the EHR optimization process in behavioral health settings. And by gathering insights from diverse user groups through surveys and interviews and focus groups and direct observation, you can identify areas for improvement that will prioritize changes that will have the greatest impact on EHR usability and satisfaction. And as we move on to this next section, we're going to explore how to implement changes based on feedback and assessment findings to enhance EHR performance, and support the delivery of high quality behavioral health care. Hey, it's time for an introduction. You ever wonder what happens when you combine a passionate healthcare advocate with a certified security guru and tech visionary? You get this guy, Thaddeus Dixon, the founder and CEO and thought leader of Xpio Health. Starting as a counselor 25 years ago, Thad realized that if you want to help one person be a therapist, but if you want to help thousands, build a better technology for therapists. And that is exactly what he's done. When he's not serving as chief information security officer for various healthcare organizations or speaking at national conferences, he's leading Xpio's mission to revolutionize behavioral healthcare technology. Please welcome Thaddeus Dixon.
Thanks for that warm welcome, Brian, and thanks everybody for being here. And so really, as we look around at how the landscape of not just healthcare and behavioral health, but technology is changing, I think it's increasingly important to look at how your EHR is keeping pace with those changes. And I think, what I'll say is sort of the first generation of EHRs, and as Brian mentioned, they never really quit evolving, right? And the technology never quits evolving. Your own system never stops evolving. But when we think about how we mitigate the challenges of a death by 1,000 clicks that our users sometimes experience as a byproduct of that ongoing evolution of our EHR, I think it's really important to come back to the optimization conversation. We're all getting new reports and new data initiatives that we have to collect information thrown at us every day. And that means new fields, new forms, new state reporting requirements. And those tend to oftentimes place a lot of burden on the end users for collecting that data. And so as we evolve our EHRs, having checkpoints to look at what the impact is on your users, have user satisfaction surveys, and determine how your workflows need to adjust is important. And I think what's also important is the tools are changing to do so. And back in the earlier generation of EHRs, we sort of just had to live with the product that we got from the vendor. And let's be honest, that didn't always live up to what we saw in the sales demo. Now, as we all organizationally become more fluent in our EHRs, we become better at understanding the ways that it was initially implemented versus what opportunities we may have. But it does require a systematic approach to analyzing what your optimization requirements are. And yes, there's always low-hanging fruit. And increasingly, tools like AI, rapid form design, as well as data warehousing and report repositories can really improve the user experience. And so as you think about your EHR, our general approach is to look at the ways in which new features, new modules, and even new technical options that have emerged in the marketplace, such as offering adjunct AI-enhanced note-taking modules to your EHR, would have a high impact on improving the clinical practitioner satisfaction with the EHR. And we find that the ability to access the data and surface it at the right place and the right time in the EHR is one of those really important ways that you can modify your EHR architecture. We have been embedding, for example, reports in line to different fields and forms in EHRs to surface what we refer to as micro insights into the workflow of those clinicians. We can surface treatment plan histories and analyze those increasingly with third-party tools such as an AI-enhanced analysis. Yes, there are security considerations for utilizing these tools. Sometimes there's third-party vendors. There's policies and procedures that go along with that. But as the market evolves, all of these different tools are becoming increasingly available for organizations to use to help improve that end user experience. Thanks, Brian.
Thank you, Thad. Okay, so how do we do it? How do we conduct a comprehensive EHR system assessment? Well, a comprehensive assessment of your behavioral health EHR is essential for identifying both strengths and areas of improvement. And by conducting a thorough evaluation, you can gain a holistic understanding of how well your EHR system is supporting the unique needs of your organization and the patients you serve. To achieve this level of insight, it's crucial to adopt an integrative approach that combines quantitative performance data with qualitative user feedback. This dual perspective allows you to understand not only how your EHR system is functioning from a technical standpoint, but also how it's impacting the day-to-day experiences of your clinical staff and patients. Here's how we conduct an assessment step by step. We define the assessment objectives, we gather the performance data, we collect user feedback, we analyze and integrate our findings, and then we utilize assessments to guide our optimization. Begin by clarifying the specific objectives of your EHR assessment. These may include identifying usability issues that hinder clinical efficiency, uncovering gaps in compliance with behavioral health regulations, or pinpointing areas where the EHR system is not adequately supporting care coordination or patient engagement. By defining clear objectives up front, you ensure that your assessment is focused and actionable and yields insights that directly inform your optimization efforts. Next, outline a plan for collecting quantitative data on your EHR system's performance. Key metrics to consider include system uptime, the speed of common tasks like loading patient records and documenting progress notes, and error rates in data entry or processing. In parallel with gathering performance data, implement strategies for collecting qualitative feedback from EHR users across your organization. This may involve conducting surveys, interviews, focus groups, or direct observations, as discussed in the previous section. Aim to capture a diverse range of experiences and perceptions by engaging with different user groups like mental health providers or administrative staff or patients. Encourage open and honest feedback by ensuring confidentiality and emphasizing the importance of their input in driving EHR improvements. Once you've collected both performance data and user feedback, the next step is to analyze and integrate those findings to paint a comprehensive picture of your EHR system's strengths and weaknesses. Use statistical analysis methods to identify trends and patterns in your performance data, such as average task completion or error rates, or you look at these metrics across different user groups and departments. And for qualitative feedbacks, you want to employ thematic analysis techniques to uncover common issues and pain points and areas of user satisfaction or dissatisfaction. With the wealth of assessment data at your disposal, it's important to prioritize the findings based on their potential impact on patient care, clinical workflow efficiency, and overall system performance. Consider factors such as the severity and frequency of reported issues and financial and technical feasibility of implementing solutions and the expected ROI, the expected return on investment of optimization. Armed with insights gained from your comprehensive EHR assessment, you can develop a strategic roadmap for optimization that addresses both short-term fixes and long-term enhancements. Use your assessment findings to identify quick wins that can be implemented rapidly to alleviate pressing pain points, as well as more complex initiatives that require careful planning and resource allocation. To ensure that your optimization efforts are aligned with the needs and priorities of your organization, engage key stakeholders throughout the process and planning process and involve clinical leaders and IT staff and patient representatives. And this is the collaborative approach that helps build buy-in and support for the proposed changes and increases the likelihood of successful adoption and meaningful impact. So there you have it. Conducting a comprehensive EHR system is a critical step in the optimization process. And by combining performance data with user feedback, you're going to follow a structured approach to analyzing and prioritizing findings. You can develop a robust optimization plan that addresses the unique challenges and opportunities within your EHR system. And as we move forward in this webinar series, we're going to continue to explore best practices for implementing optimization strategies, monitoring progress, and measuring the success of your efforts to ensure that EHR system continues to evolve and support the delivery of high quality behavioral health care. Okay. As we wrap up today's webinar, I'd like to leave you with a thought. Learning to love your EHR may not be as thrilling as the real thing, but it can be surprisingly rewarding. It takes time, effort, and a healthy dose of patience. With the right approach and a commitment to continuous improvement, you might just find yourself developing a genuine affection for your EHR system. Okay, I know, there I go again. Maybe affection is a stretch. But by conducting a comprehensive assessment that integrates performance metrics and user feedback, you can certainly unlock your EHR's potential to support and enhance the delivery of behavioral health care. Let's turn to our panel. Let's hear what they have to say, and then we're going to address some questions from our viewers. Hey, panelists, do you have anything to add?
All right, the very first question is, we're seeing significant clinician burnout related to our EHR. What's a realistic timeline for implementing optimization changes that could help address this? Thad, would you like to take that one?
It's a great question, and it speaks to one of the realities that we all contend with, and that is both a workforce shortage and partly driven by incoming qualified applicants, and also by those who may be leaving, after spending, 5 years, 10 years, 15 years providing direct service. As a former clinician myself, I can really appreciate the just challenges placed on providers with having to see X amount of clients, having to get notes in a timely fashion submitted, and having to deal with really all of the human to human and emotional just challenges that come with being a direct service practitioner and a clinician. It's a hard job. And, I really appreciate that. Not only is the work of being a clinician a hard job, but now we've also made our clinicians data entry staffers. And so when it comes to how you can approach and the timeline required, the optimization, I think that realistically, if you're collecting data on, for example, where your high sort of pain points are in your EHR, as Brian has suggested, through some, really easy, type of surveys, I suspect most of you probably even know organizationally, what are the really hard things to accomplish in our EHR in a timely fashion. If you bring that good data to the table and we show up with that information in hand, and we know that this process takes 15 minutes to complete from end to end, then we can typically focus on that particular optimization issue. And we can then, after about a 30-day analysis of observing and of collecting information on how it's being done today, the baseline, and what it is that needs to be essentially modified in the workflow to help improve that experience. It's 30 days for analysis, and depending on how many modifications are required, it's 30 days for the remediation. So we tend to look at it in what we call sprints. So it's a 30-day baseline analysis and understanding of what the problem or problems are and where the highest opportunity is for improvement is. We collect those low-hanging fruit optimization items, and then we develop a strategy for implementing those in the EHR over the next 30 days. So 30 days of analysis of the problem and the baseline and the timing that we can help improve, or the elegance of the workflow. And sometimes it's patient safety issues. Sometimes it's time. Sometimes it's, collecting data for a certain project or report that's needed. And so sometimes you have to question what it is you're collecting and why. But once those things are analyzed, we like to give ourselves a 30-day sprint to modify the forms that may need to be modified, add the new forms. Oftentimes, we can identify areas in the EHR the data is already being collected. A lot of us, especially clinicians, collect redundant data. And so what we'll do oftentimes is create a consolidated type of data collection instrument, which can pull values already resident in the EHR and pre-populate those data elements, so that when you're filling out that particular assessment, you don't have to re-enter the name and the date of birth and the, previous diagnosis and the treatment plan objectives. We can pull that in to a new consolidated assessment, for example, or face sheet, and we can help then expedite that by simply leveraging the EHR data that's already present. So we really look for quick wins in the optimization. And so if you show up, for example, and say, hey, here's the list of things that we have identified that need to be optimized, then we are tooled up and ready for a 30-day sprint to help fix those. And one of the things that I will say that is really helpful about working on a bunch of different EHRs is it gives us insight into how different systems may approach the same problem that your EHR is facing. And so we can really leverage that knowledge from other customer experiences to help say, this is how this customer solved that problem. We're working with, 100 customers at any given time, 50 active different EHR optimization and data projects every 30 days. We have probably, like they say at State Farm, seen a thing or two because we've been there. And so I think that at the end of the day, we really want to see a 30-day turnaround for an optimization modification that can give a good high value win to your clinicians who are on the front lines of collecting this data.
Thad, thanks for kind of sending that home. Jill, what else do we have?
Another question that we received is, how do you balance customization requests from different departments while maintaining system standardization?
Also such a good question, and one that, many of us have probably been through several EHRs in our lifetime of working in behavioral health. And I will say that managing the tension between flexibility and standardization is one of the ongoing challenges of optimizing your electronic health record system. And prioritizing those many requests for this change and that change is a challenge. And, I'll use the phrase that we often use when we work with customers on this, and it's data governance, data governance, data governance. Now, what does data governance mean? Because it's easy to say and sometimes hard to implement a process organizationally that can really manage that. One thing is establishing a ticket system that has a way to tier and triage, if you will, the incoming requests as essential functionality, as nice to haves, as wish list. Those are really important. And one of the things, as we see the ongoing use of AI in healthcare, knowing that there is some barriers for adoption related to just getting our data into the kind of shape that an AI model can really even read. That's one fundamental challenge. But another fundamental challenge is PHI. Most of us probably use ChatGPT and OpenAI for our different non-patient sensitive data requests and questions all the time. But this right here is actually a really good use case. If you have a ticket system that has some level of tagging on your requests, and you can, especially if you're dealing with a high volume of those, you can run an AI model and you can provide some data related to basically the value of those different types of data governance questions, and you can lean on and collaborate with your AI model to help put together a framework for data governance. And I think there's some key questions to ask yourself. One is you have to pro and con the impact of the modification. And so when a user is asking for a change, you need to link that back to the business objectives. And so data governance is really that touch point of, okay, somebody's requested a change because this is requiring them to double data enter something 14 times, and it's taking a lot of time. One of the first questions is, how many users are affected by this? And so that's one of the baselines. And then another question to ask is, what could be some of the downside implications of making this change? And then I think a third question to ask is, what is the scope of time and effort required to make the change? So if those three things are added in to a ticket request model in a spreadsheet, the tickets are triaged, and you have some level set of time, effort, energy, and benefit, then you can really leverage an AI analysis of that to pretty quickly determine an order of priority for managing that. And then I think that those requests, once I'll say the data team and the clinical team has a set of recommendations for what needs to be changed, a list of the impacts of the change, either positive or negative or both, then you can weight that 80-20 for positive benefit, 20% negative, and you can come up with a list of 5 things to the data governance and the business team and say, hey, here's the cost of these changes. Here's the benefit we will get from them. And so this is the approach that we would suggest. And even if you don't have a formal data governance team, your C-suite, your business leaders, those who are looking at the priorities strategically of the organization, they can vet that list against those requirements that you've already put together. And that'll go a long ways in advocating for the changes and helping also manage them. Because when you have transparency in that process of data governance, you vet it against some type of formal process, you can then communicate back to your users, this is why we aren't making that change today, and you can put a timeline on it, or this is why we are going to make this change. And let's get with now the team that is going to be helping you, the SMEs, make that change and ensure it's implemented well. When you get those wins, you can help make judicious decisions about what you change and when.
Thank you for that, Thad. Okay, we have about 4 minutes left. You want to try one more question, Jill?
Well, I was kind of wondering the same thing, Brian. One of them that I do think we could probably handle rather quickly is related to what role should clinical leadership play in the EHR assessment process versus IT leadership?
Again, such a great question, and it's probably an overused phrase, but the three-legged stool, which needs, participation from the business and the financial team, the clinical team, and the IT team, has to be well balanced. And I'm a big fan of clinically identified and then data team vetted optimization processes that go to the data governance and the business leadership team, because there is a cost implication. Time may be the cost, money may be the cost, unintended consequence may be the cost, but change is not without cost. And so even in service of optimizing your EHR, having a good rubric for how you decide, and then getting your appropriate stakeholders at the table. Now, will you ever make a single change if there's 20 stakeholders and you are going to then be tied up in a committee for 6 months? That's the downside. But I really think a balanced approach between the clinical leadership, who really knows the impact of the workflow in place today, with what I'll call it as kind of a reality check of the data team to say, that change would be great, but it's going to take 100 hours, and we're going to have to re-architect the entire interface in order for that change to be feasible. And it's not that we don't think that change might bring value, but maybe there's more low-hanging fruit that we can attack to get a good win and show that our process is working without being stuck in a protracted decision-making process that doesn't yield an outcome.
Right. You're talking about ensuring that the juice is worth the squeeze, right?
Another great phrase. And that really does, I think, require a balanced approach. I think that IT project or EHR implementations that are led just by IT tend to have a high failure rate. And at the same time, it would, also goes to say that just a clinical team, if they independently lead that, it also can have unintended consequences, like I mentioned, of things that are just really hard to implement. There are always going to be constraints, and being able to have a good understanding of the technical implications of that clinically required change is a really important dialogue to have with that team. And then again, vetting that back up to the business team and saying, hey, will this change yield a benefit that the overall organization is willing to support? A time benefit, a patient quality benefit, a data quality benefit. There's a lot of benefits that you can identify, but it needs to be articulated so that the business side of the organization can respect why that change is warranted.
Fantastic. Thank you so much for that, Thad, and thank you so much to our panelists for uh, some great insight. I want to thank everybody for showing up here today. I hope that you've learned a little bit more about how we're going to get you to one way or another love your EHR. And so join us again at our next session. Meanwhile, thank you so much for being here.